Okay.
Good day, everybody. Good day, everybody. Welcome to our training session. We are going to do advanced expert skills today, specializing in skin and zone analysis. So it's a really nice workshop that we divide into two training sessions. You'll see it's quite a lot of information, but we'll do half of it today and then half of it in our next session. So let's talk a little bit about skin analysis. If we think back to the days when we studied beauty therapy, it was really something that was drilled into us, doing a thorough skin analysis, a thorough consultation. But I do find that it is something that a lot of therapists neglect, but it is such a crucial part of our treatments. If you think of the actual definition of skin analysis, it is an important part of the treatment where we determine what is our client's skin type, what is the condition of the skin, and what type of treatment is needed for the specific client. And it's really where we look for information. But I find a lot of therapists are scared of analysis or they're scared of a consultation. But in fact, it's just looking for information and sharing that information with your client. And doing a good consultation is the key to a successful facial or successful treatment, and the key to actually getting the right results, putting your client on the right treatment program. So, how does a thorough skin analysis benefit your client? It gives your client a clear picture of the current state of her skin. And then you can also look at a treatment program to obviously address her needs. Clients a lot of times have a specific idea of their skins. They will maybe go to a lady at the pharmacy, or in South Africa we've got like Edgar's, so your over-the-counter shops where you can go and buy makeup or skincare, and they will do an analysis for you, but usually they don't remove your makeup. The lighting in those shops are usually quite bright, or it sort of it camouflages your impurities almost, so your skin looks a lot more perfect. So it's usually not a clear picture of what your skin looks like. Or they will, your client will read in the magazine, what skin type do you have? And there's a quiz, and they go according to what they read. But it's not always the right information or a correct analysis of the skin. So doing a thorough analysis really gives your client the ability to take control of their skin's needs, and also to make sure that you detect any possible concerns at an early stage, so that the amount of treatments that might be needed can be reduced, and possibly even saving money. So if the skin is, for instance, dehydrated, the sooner we can pick that up, the sooner we can treat it, and we can move forward to getting good results for her. So skin analysis should be performed every time you see the client. So with every single facial, whether she's coming in every week or every month, any changes have to be discussed with your client, especially if you are working with a treatment program. And obviously, as the seasons are changing, if the client is maybe pregnant or anything changing in her lifestyle, you as a therapist need to pick that up. So what do I need when I do an analysis or an consultation? Your client consultation form, proper lit room, preferably a magnifying lamp. I cannot do a facial without my mag lamp. Your zone analysis consultation card, and most importantly, your knowledge. So at the end of the day, we as therapists, we are the experts, and we are basically here to help our clients. And that's why our clients come to us. So this is our Theravine skin analysis card. We will look at this at a later, probably in our next session. We will discuss how to use this a little bit more in detail. Great tool to help you with your analysis, to really focus on specific zones, what is happening on the skin. It really works very well. So some important notes when we do our skin analysis. So your client will complete her consultation form. Always make sure you cleanse your client's skin, cleanse and tone, give the client a nice relaxing experience, and really allow the client also to relax while you're doing your analysis. I usually cover my client's eyes so that she doesn't have this bright light shining in her eyes, and then inform your clients of all the findings, which will then start making her aware of what is happening on the skin, and it helps you to start making connections. So what is she using at home? What are you seeing on her skin? What is her lifestyle? What is the skin condition? So starting to connect the dots so that your client can really start understanding her skin better. And I find the better our clients understand their skins, the, the more they're able to take responsibility, to be more serious about using the right home care. So it's really all about educating our clients about their skin and starting to educate them on the products we are using, our active ingredients, and what are we going to do in our treatment and the home care to achieve a specific result or treat her skin concerns. It's all about the education with your clients. So make sure of your skin analysis on your consultation form so that you can keep track of any changes. Next time when she comes in, you're probably going to forget what you saw last time. So if you just make a little note, you can just quickly refer back to it and just check up on her sensitivity or her breakouts or whatever it is that you've noted on the skin. So now we're going to talk a little bit about skin types and skin conditions. So a skin type is genetic predispositioned. So you are basically born with your skin type. Yes, when we are babies, when we are young kids, our skins are basically perfect, normal, just a beautiful young skin. As we go into puberty, that's obviously when we start getting our skin types. And it is mainly influenced by sebaceous secretions. So you'll either be normal or dry or oily or sensitive skin type. I think of my own skin. I've got a twin sister. We always used to have perfect skins. When we went into puberty, my sister's skin was just perfect, dry, more dry. Oh, this thing is too fast for me. More dry, hardly any breakouts, where I was the one who became oily, breakout, more acne prone. And I mean, we twins, we used to eat the same food, do everything exactly the same, wear the same clothes. So it's not like we did anything differently. So I got my dad's side of the family skin, and my sister's got my mom's more dry skin. Then skin conditions is basically influenced by internal and external factors. Now you'll see these symbols, you'll see these symbols here on the PowerPoint. Now what we've done with Theravine is we've basically divided a whole range into different skin conditions or skin types. So these symbols will then just represent different conditions that we're going to treat. And you will find them in all of our training manuals, the new manuals that we've got. So your first one here is your daily defense, so basically treating pollution. The green one is first lines. Then you've got collagen support, advanced anti-aging, devitalized skin, so skin that needs a boost, Melanivine, which is for pigmentation. The little water drop is dehydration and sensitive skin. Then you've got oily combination problematic. This one is men. Then you've got your ICT, or stem cell technology, ice crystal technology, and then you've got your pro youth, your youth range. So let's have a look at our different skin types. So what's your skin type? And I think that's something everybody always want to know. What is my skin type? You know, if a client, you know, especially a first-time client who doesn't really know that skin that well, that's always the first thing they want to know. So we've got 4 different skin types: normal, dry, oily, and sensitive. So it's all about the oil secretion. Let's look at them. So normal skin, that perfect skins. You don't get a lot of people with normal skins. There's a perfect balance between oil and moisture. The pores are small, barely visible, so the skins are really that beautiful, beautiful, smooth, supple texture. Just really, really like perfect. They don't get breakouts or minimal. They might get the odd hormonal breakout. No irregularities. And for them, they really need to follow a very good daily routine to maintain a good health, a healthy skin. I find a normal skin does age very quickly because their skin is just so perfect. When they are younger, they don't usually spend a lot of time on the skin. They maybe just splash it with water, put on some baby cream. But as they get older, they do age. They get lines quite quickly. I have a few friends who had this perfect skin when we were in school. I'm going to be honest, I was quite jealous of them. And they never really used to do much on their skins. And now that we are like in our late 30s, I look at their skin and they really are aging quite badly. Where me myself, well, obviously I'm using Therapine, but and obviously I've got oily skin, so that oil does nourish the skin a bit more. But I've always been really attentive to cleansing my skin, moisturizing, using good products. So you can definitely see that, especially on a normal skin. So just very important to educate them. Normal skin is actually very unusual since most clients will have some form of irregularity, especially with hormones or with with our climate, especially in South Africa, the climate is extremely harsh. So you don't get a lot of normal skins. Then a dry skin looks really uncomfortable. So low sebum production, they often fail to retain moisture. Their barrier is usually also quite stripped. They age a lot faster because obviously they don't have that lubrication of the oil. Easily leads to lines and wrinkles, dry and rough to the touch. They can be flaky. Pores are very small or not visible. And a dry skin usually feels dry the whole day. They will feel dry after cleansing. Throughout the day, they will start feeling quite tight and uncomfortable as well. And this is usually your clients who love rich products. They will usually tell you, I love a rich moisturizer. To keep your skin healthy, you should apply thorough care. Increased water intake can definitely improve the overall hydration levels of the body in assisting in the skin in that process. So can definitely help with hydration from the inside out. With them, make sure you incorporate hydrating masks, serums, richer treatment creams like your rich collagen, your ultraviolet advanced range. They love balms. They love our oils. And a lot of times when I do my consultation and analysis, I will ask my client, what type of moisturizer do you prefer? And usually a client who's a true dry skin will say, I love a rich cream. I always go for the richest products that I can get because my skin is so dry. Then are oily skin types. This is such a funny picture. Shine bright like my forehead. So yeah, obviously shine, enlarged pores, over secretion of sebum. The pores can be blocked, so they can have blackheads, whiteheads, or pimples. But not all oily skins are actually problematic. I know a lady who's got a typical oily skin, large pores all over. She's got quite a bit of blackheads, but hardly any breakouts. So her oil balance is actually quite good. Her hormonal balance is good. So, and she's really aging quite well. She's not getting any lines. The skin is really, really firm. An oily skin does easily attract dust and dirt from the environment. So that's usually why they will have more blackheads. So definitely larger pores. The skin can look quite like a rough texture, like a coarse texture, almost like an orange peel look. So these clients usually want to reduce their pores. They want something to make those pores smaller. They usually want something to mattify the skin, to reduce the shine. And they also usually struggle with foundation because it just runs off the face. The good thing though is that oily skin is not so prone to premature aging and wrinkling. So if you look at an oily skin, they usually do age a lot slower than your other skin types. And I must say, like me personally, I found as I get older, my skin is not as oily as what it used to be when I was a teenager or in my early, I would say under 30. So it does reduce a little bit when you age. Let's have a look at a sensitive skin. So I know a lot of clients will say that they're sensitive because most of them are actually sensitized and not true sensitive skin. So true sensitive skin is really somebody that is born with it. So from a young age, like from being a baby or a young kid, the mom must be careful what baby products are she using on the baby or the little toddler. She must maybe use a specific washing powder. She must just really be careful of the products that she use, because from a young age they are usually very, very sensitive. They can a lot of times also be prone to eczema, even from a young age, like being a baby, as well as they're a lot of times prone to asthma as well. And it's interesting, I've seen a lot of times the relationship between these three. I see sensitivity, asthma, and eczema a lot of times on one client. It's not really something that I've ever noticed before, but since I've done a bit of research, it is actually quite common. So something to look out for, and then you'll really know it's a true sensitive skin. Obviously, not everybody has got all three of them, but definitely something to look out for. So, so most of them are really, really born with it. Your redheads and blonde hair can be a little bit more prone to sensitivity, but it's not just limited to a light skin. So they usually fair, thin epidermis, and they usually have redness, especially on the cheeks. Those beautiful red cheeks. I remember I used to have this friend. Her cheeks were always so nice and red. It just looked so nice. She had this natural blush, this natural color on her skin. But now if I think back, I'm like, shame, she actually had a really sensitive skin. And her skin was literally constantly irritated. So, she actually still now suffers from sensitivity. It's a bit less, but from a young age, you will usually find sensitivity. So when treating a sensitive client, cleanse without harmful irritants, prevent lines and wrinkles from developing, moisture with products that's free from perfumes, chemicals, dyes, or any other harsh ingredients, and protect the skin from the sun and free radicals using sun protection. My mom is sensitive. She's always been sensitive. She always has to be careful what type of product she uses. She can't just use anything on the shelf, or even some professional products she can't use. And when I started working with Theravine, I decided to try, obviously give her some products to see if it works. And she's been using the brand now for 7 years and she's never had an allergic reaction. Her skin is actually in a really good condition. She's in our most active anti-aging range, the Ultraviolet Advanced range. And so I must say, if somebody's sensitive, and if my mom can use Theravan, I almost want to say most clients with a sensitive skin will be able to use our products. Obviously, because our product doesn't have any perfumes and colorants and alcohols and all those nasty ingredients. So products to avoid for sensitive skin is granular exfoliators, clay masks, because that can really be irritating on the skin, ingredients that are too stimulating or that heats up on the skin, avoid soaps and harsh firming agents, and products that's artificially fragranced, colored. So most of your over-the-counter products, they usually need to avoid. Let's have a look at our skin conditions. So skin conditions is usually caused by internal factors. So it can be medication, hormones, diet, water intake, stress, and illness. It can also be caused by internal factors. So internal is obviously medication, hormones, diet, water intake, and stress, and external is the environment. So the climate, not taking good care of your skin, over peeling, over stripping, not good skincare products, and not following a healthy lifestyle. So let's have a look at different skin conditions. So combination skin. Now, we used to say that a combination skin is actually a skin type. And I think actually if I go back to my beauty therapy manuals, when I studied, we were also taught that it was a skin type. But if you think of a combination skin, it is usually influenced by the environment or internal factors. So it's not really a proper, true skin type. So that's why we classify it under a skin condition. And I mean, a combination skin is usually known, or it's called the South African skin type, because of our climate that actually influences skin to become combination. So that's why we classify it as a skin condition. Then problematic or acne-prone skin, dehydration, sensitized skin, premature, mature skin, and pigmentation. Now, on mature skin, I also remembered in my beauty therapy manuals, my skincare, when we studied beauty, my skincare manual actually said that aging was a skin type. They said that from the age of, or it was now mature skin, but mature aging is the same basically. They said that from the age of 40, your client has a mature skin. So you can even be an oily mature or dry mature. It really wasn't about the wrinkles and the signs of aging. So I think it's sort of still a little bit of a gray line. Obviously, I studied many years ago, so things obviously have changed a little bit. But yeah, we classify it as a condition. And then pigmented, like I've mentioned. So let's start with our first skin condition and see how far we can get today. Okay, so combination, really, one of the most common skin type or conditions that we find. So it's usually a skin that consists of both dry or dehydrated and an oily skin. So each zone basically requires different treatment, and the skin needs to be treated very carefully, providing a good balance between oil and water. So you don't want to overstrip the skin, and you don't want to over moisturize. You don't want to use something too heavy for combination skin. So we get two different types of combination skin. Your combination oily, where you get a wider distribution of large pores, especially down the center of the face, extending to the outer cheeks. The pores become smaller towards the edges of the face. So by the outside, closer to the ear, the pores are finer and the skin is definitely a little bit more dry on that area. You'll find comedones, clogged pores, or obvious pores in the center of the face. So on the T-zone, you'll find enlarged pores, and even on the inside of the cheeks, you'll find enlarged pores as well. So it's quite a wide, oily skin. Then your combination dry, obviously obvious pores down the center of the face, pores not visible or becoming smaller towards the outer edges of the face as well. So also towards the ear, may have clogged pores on the nose, chin, and center of the forehead, dry, poreless towards the edges of the face. So they definitely tend to have dry cheeks, where your other one tends to be a little bit more towards the oily, little bit more normal on the cheeks. Then you've got your two different, your minor or your butterfly, that usually you will find one or two areas that's oily. So it's not the typical T-zone. And I actually find a lot of clients have the minor combination, where you'll find usually congestion and enlarged pores on the nose and the chin, or the forehead and the chin, or the forehead and the nose, or the nose and the inside of the cheeks. I especially see a lot of clients with the fourth picture, where they have congestion and enlarged pores on the nose and the chin. For me, that one is very, very common, or the nose and the forehead. So I don't find that many classic. Now my one slide literally disappeared now. I don't know where that slide went, but so most of the time, so I find a lot of the butterfly client. Then your other ones will be the typical T-zone that they show here, where you've literally got your oil on the T-zone and the cheeks going more normal to dry. Then if we look at our next skin condition, which is oily, problematic, and acne skins. Sorry, I also am missing there we go. So this is a very nice picture of showing a normal skin and an infected follicle or problematic skin. So if you look at the picture on the left, the sebum is normal, the sebaceous gland is a normal size, there's no inflammation, the skin is just healthy. If you look at an infected follicle, now it is usually also a genetic condition where the sebaceous glands are enlarged. That is usually what you will find on an oily skin. It's basically a genetic, I don't want to call it a fault, but it's something in your genes that is basically going to make your skin, that's going to cause your sebaceous glands to be more enlarged. Not everybody will have that, but there's just certain people who will have an enlarged sebaceous gland. So that means the skin is going to produce more sebum. Okay. So here you will see an enlarged sebaceous gland. There you've got a blackhead that obviously traps the oil. So your sebaceous gland is secreting lots of oil. The oil cannot flow out because it is basically plugged or stopped by a blackhead. So then the oil is all going to literally build up, push down towards the sides. And the sebaceous gland almost in a way stretches and pushing up towards the skin surface. And that's when you get your papule. So it's like a filled sebaceous gland. Then you get your bacteria that infects the pore. So inflammation sets in, your body starts to fight this bacteria, and you get your pustule, where you'll find pus, inflammation, it's swelling, it's red. You can almost feel your heartbeat in that pustule. So it's basically an ailment of the sebaceous follicle, which leads into the hair canal. That's actually the word I was looking, it's an ailment. So it's a genetic ailment, basically. And it usually is genetic. So if the mom had acne, the child can have acne. And a lot of times it come back later in life as well. I find a lot of times clients will go on Roaccutane when they, let's say, 16. When they're 21, they need to go on it again. When they're 30, they need to go on it again. And even in their later adult life, like when they're 40, they end up with adult acne. It's like something that's just reoccurring because of this ailment that is in the sebaceous follicles. Let's break it down a little bit more. So here's a very nice picture of a healthy sebaceous gland, your first little pic. There you can see the sebaceous gland is small. There's your hair follicle. There's a whitehead, so it's clogged. Then you've got your blackhead, which is basically an open comedone. So whitehead is obviously closed comedone, so your blackhead. Then you've got your papule, where it's filled up. You can see there's a lot of oil, and the oil is also pushing into the sebaceous gland. And then you've got your papule, and then you've got your pustule, where there is inflammation. So really large papule pushing up, pushing towards the sides. There's redness, there's pus, and the oil is literally also going more down towards the deeper layers of the sebaceous canal. A lot of inflammation. Oh, sorry, just go. Oh, no, there we go. So let's have a look at your different types of acne. And what do we see on the skin? So you get a closed comedone, basically a whitehead, what we call a whitehead. They're small whitish or flesh-colored spots, just like a little bump on the skin. They usually have a white circular center surrounded by a red halo. The skin around a whitehead may appear to be tight or wrinkled, especially when the whitehead is large, or especially if it's quite raised. Then you've got your open comedone, which you all know as a blackhead. Small black or dark colored spots may appear as slightly raised bumps, especially if they're really filled up. The coloration is not a result of trapped dirt. It's basically a whitehead that have been opened or widened, and it basically coming into contact with air. So they become oxidized, and that's when they get darker. So a lot of times people will think, oh, I've got blackheads, my skin is so dirty, it's all the dirt that's in my skin, but it's actually just oxidation. So it's a whitehead, but it's become oxidized, so it becomes black. Then a papule. So there's obviously no inflammation with this. It's literally like a bump under the skin. You can't squeeze it out. You literally just need to leave it. They are solid, tender, pink, and raised. And the skin around a papule is usually slightly swollen or red. So you usually does feel a little bit tender. they develop when whiteheads or blackheads cause so much irritation that they damage some of the surrounding tissue, and the damage leads to inflammation. So it's obviously all that trapped oil, and then you get the inflammation, and there you get your papule. Oh, sorry, let me just get to my next one. There you go. I want to begin with the bottom one here, a pustule. So that's basically larger tender bumps, also with a defined circular center. So it's that white pus. The center is filled with whitish or yellowish pus, and the bump has a pink or red base. Now with this, your immune cells and bacterial cells collect to form this pus. So it's literally your body going to fight this this bacterial infection, and that's when the inflammation sets in. So that's basically the difference between a papule and a pustule. Then your nodule. A nodule are hard, painful, inflamed lumps located deep within the skin. They look like larger, deeper papules, but have no visible center or head. It's just like a huge papule. And they usually do go quite deep into the skin and really push towards the sides of the sebaceous gland. And they're really, really painful. We obviously don't treat a nodule. And a cyst, we also don't treat. They are very large, soft, painful red and white lumps. They're really, really deep. They are filled with pus. They are deeper within the skin than a nodule. And they are most severe. This is really the most severe type of acne. Cysts can also cause skin complications like really, really severe scarring. It really leaves bad scarring. And we do not extract a cyst. They usually need to go to a dermatologist. So we don't steam and extract a cyst. We can really cause major, major damage on the skin. Then if we just look at the grades of acne, I want to look at the grades of acne before the causes and factors. So grade 1 is just your blackheads and whiteheads. Grade 2 is the above, so blackhead, whiteheads, pustules, and papules. Grade 3 is then all of the above, so blackheads, whiteheads, pustules, papules, larger papules and pustules. Grade 4 is literally all of the above and cysts. So therapists usually treat only grade 1 and 2, although I have treated grade 3 clients recently actually with Theravine, and I've really gotten very, very good results. But obviously the way that you treat them needs to be in a very different way. And I find usually grade 3 can be quite don't want to call it an unstable skin, but they're quite reactive to changes or to overstimulation. They can really quickly just get a breakout if you use something that's a little bit too stimulating on them. But I do find that we can definitely treat grade 3, but obviously just monitor the skin, but definitely not a grade 4 with your cysts. So causes of acne: imbalance of microflora, follicular inflammation, and loss of hydration. Then factors that can affect acne: climate conditions. So hot, humid climate. I usually find when we go to Durban, I always get a breakout because my skin is just not used to that humidity. Medication and drugs. Stress, because that obviously increases your adrenal activity, increases your oil secretion. Genetic, like we said earlier on, using the wrong products, topical preparation, so that's usually like makeup. I find even a lot of makeup primers that you find on the market these days has got like a waxy consistency, and I've met a lot of people who started using makeup primers and they really started getting bad breakouts from it. So I think that can definitely clog the pores. And then hormonal imbalance, major, major, major. I find this is almost like number one of the causes of acne. Then with diet. Now, with diet, people will say avoid pizza and chocolate, junk food. You know, we know that they aren't good for our health. They don't cause acne or make it worse. A lot of people will say, it's just a myth. It's not going to do anything to your skin. There's been a lot of studies that show that dairy and high sugar intake can definitely trigger acne. I've read quite a lot of articles on especially dairy that can be related to acne flare-ups. I know a lady who's literally cut out like dairy and wheat. So it's the things that she finds she might be intolerant to. And since she's been changing her diet, her skin has cleared up tremendously. So, so we say, avoid chips, crackers, cookies, your starches like white bread, pasta, potatoes, sugary drinks. And some research suggests that dairy products, especially milk, can contribute to flare-ups. It's not for sure, and the exact link between the two isn't clear, but it may be that the growth factors and hormones that's naturally found in milk somehow acts as an acne trigger. Or it's literally like your body going to an immune defense because you might be intolerant or allergic to that. I personally found when I was young, being a teenager, I didn't eat very well. So my mom actually took us to a dietitian. And she put us on a really good, healthy eating plan and drinking like 3 liters of water every day. And I saw a tremendous improvement in my skin by eating more healthy. And I definitely think the drinking water helped. And until today, I still eat that way. I still drink a lot of water. So I really believe that it does have an effect on your skin. I also did a case study on a young guy with quite bad acne, like a stage 3 or grade 3 acne. And he's in IT, drinking lots of coffee, Coke, and sugary, chocolates, and not having a good diet and not drinking water. So I said to him, you know what, cut down on your caffeine and your coffee and your Coke and your sugar. And I think I even got him to quit smoking and drink more water. And for me, what was very interesting, the blood that came out, when I did extractions, the blood that came out of the extractions was quite dark. But a month later, he obviously changed his diet and everything in the meanwhile. A month later, the blood that came out were a lot lighter. His skin definitely did improve, but just looking at the change of his blood really showed me that by him actually changing his diet, drinking more water, it literally like flushes out the toxins. And that can definitely contribute to breakouts. So I really believe that advising our clients a little bit on the diets, especially with an acne skin, drinking water, what are you eating? A lot of people, especially your youngsters, that just don't eat enough. They actually need to eat food. They might think they're too skinny, so they might be a bit anorexic or whatever. Sometimes by just eating more can actually clear up your skin. I've seen that. So just something to keep in mind when you are treating an acne client. Then things that can also obviously cause acne is your postmenstrual tension, where progesterone interfere with the regulating effect that your estrogen usually have on your sebaceous glands, and that can definitely result in more sebum flow. So that's why a lot of clients can suffer from premenstrual breakouts. Also, if you believe in Chinese diagnosis, where you look at the face and different areas that represent your reproductive system, a lot of times you will have your breakouts there, like on the jawline or the chin. With pregnancies, a lot of clients do get acne during pregnancy due to an increase in hormones, so your androgen, and that can really cause the glands in your skin to grow and produce more sebum. And that can obviously lead to clogged pores, bacteria, inflammation, and breakouts. And then cosmetics. Cosmetic and skincare products, some of them are actually pore clogging, but you also get some amazingly good cosmetics these days. So for me, a client using the wrong foundation is not really acceptable anymore these days, because you get amazing mineral-based or very good quality foundations. So just once again, maybe advise your client, change your foundation, or if you think it might be not a very good quality cosmetic that she's using. Then stress and sleep, quality of stress and sleep can also cause breakouts. Obviously, in today's society, lack of sleep is often due to stress, a lot of stress. A lot of people I meet suffer from insomnia. So if you think of what is affected by not sleeping enough and stressing too much: poor oxygen supply to cells, poor concentration, irritability, skin concerns such as acne due to increased adrenal levels, and the skin can appear dull and pale with dark circles around the eyes, and definitely experience breakouts. Like on the jawline, I find is definitely the stress area. And I know a friend, she used to constantly suffer from adult acne. She's a teacher, and she quit she stopped teaching now for a while. It's actually amazing how clear her skin is. Oopsie, there's just something that popped up here. So that's also something to think of. A lot of times when I get a client, she'll tell me, oh, my skin, I've got a breakout. I've been so stressed. So people almost know that the breakouts is a lot of times related to their stress. I'm tired because I'm stressed. I'm stressed because I'm tired. That is a problem that a lot of our clients have. Sorry, now this one popped up again. So how does stress cause breakouts? So stress increase your adrenaline levels. So that is going to cause excess oil to be produced, toxins, and toxins will obviously build up, and then the healing slows down in the skin. Then you get basically bacteria growing, and that can then cause breakouts in the skin. And then they scratch usually as well. And also one thing I want to know, just mention on problematic skin, what I've seen with a lot of therapists or case studies I've been treating in the past couple of years. I met a therapist once. She had really bad cystic acne, and she was using good products. She was using Theravine, and I think she was also stopped Dermalogica. So she was following a good home care routine, but her skin was really very, very bad. And she got married. So just before she got married, she went to the gynae, obviously to go into the pill, and the doctor basically found out and diagnosed her with cystic ovaries. And he treated the cystic ovaries, and her skin cleared up. Amazingly how her skin cleared up. So then I realized, we as therapists, yes, we do amazing treatments, and we really work towards getting amazing results, and we do achieve great results. But also keep in mind, when it comes to acne, it is a lot of times something internal, especially with your female clients. What I always ask my client, especially if I see it's quite cystic, it's on the jawline, it's like the breakouts is just not going away, or it's going away a little bit, but then it just comes back, and it's quite cystic, so it's quite deep, I usually ask them, how long ago have you been to the gynae? Is everything okay? Because a lot of times I've seen now about 4 or 5 different clients had cystic ovaries, they treated it, and the skin cleared up. This other case study I did the intensive exfoliant on, also adult acne client. She's also very stressed, but there was just something just told me that it's not just the stress that's causing her breakouts. And I said to her, how long ago have you been to the gynae? No, I've been there recently. Everything is fine. We got results, but it's just like her skin just didn't clear up. I went on maternity leave, so I didn't treat her skin anymore. And she basically went to the gynae because her skin got quite bad. And when I got back from maternity leave, she came to me again and we were talking, and she's like, oh yeah, I went to the gynae and I've got cystic ovaries. And I said to her, but I've been nagging you now for over a year to go to the gynae, and I was actually right. So it's not for us, obviously, to tell a client, you've got a problem or you've got cystic ovaries. It's really just to advise them into the right direction, because that might be the problem of their constant breakouts. Another client actually had very high testosterone levels. She's a dry skin. She's got dry skin, but she gets like also sort of like breakouts on the chin, but there's no pus. It's also like a papule, but there's just fluid that comes out. And she also has quite a bit of hair growth, like on the chin. So abnormal, a lot of hair growth for her age. And I also just said to her, you know what, maybe just check it out. And the gynae tested her testosterone levels and was quite high. So that was the cause of her breakouts. So really just important to notice that, and just to make sure that your client knows what's happening in her body. Then with dehydration, so let's have a look at the difference between a dehydrated and a dry skin. A dry skin is a permanent dry skin. It's usually they're born with a dry skin, they have it through their teenage years, and when they get older, it's genetic. They lack oil, the skin is rough and flaky, like we looked at it earlier on, very small pores, very fine skin. A dehydrated skin is temporary, so it's a skin condition caused by external factors, can also be internal, obviously, lack of water, and the skin is dull and tight. And a dehydrated skin can literally be any skin. Any skin can be dehydrated. So let's have a look at a dehydration. A skin condition, it's basically a skin condition that lacks water. So there's a loss of water. And if you think of water is needed for every single tissue in our body. It's needed for our skin. It's needed for our body. I always say, we can die of dehydration. You can go without food for a couple of days, but you need water. The same with your skin. If your skin is dehydrated, it is actually an unhealthy skin. If your skin is dehydrated, your skin cannot produce ATP, so you don't have energy in the skin. So your skin cells cannot function effectively. So the skin will look dull, it will look tired. You can use the best moisturizer in the world. If the skin is dehydrated, it's not going to work. You're not going to get sufficient results that you're looking for. And your enzymes cannot function effectively. So once the skin is dehydrated, your skin will hold on to the dead skin cells, obviously leaving the skin flaky, leaving the skin feeling really rough, but also trapping oil. And that's a lot of times something that I find that you get in oily skin that's dehydrated. If that's dehydrated, the skin just becomes worse. because the enzymes is not working. And we are created with this amazing natural desquamation process in our skin. We weren't created to use exfoliators because our skins are supposed to exfoliate itself. But because our skins are so dehydrated, these enzymes actually cannot function. So your skin holds onto all of these dead skin cells. So the first thing that we usually need to address is dehydration in the skin so that the skin can start functioning normally. So do you think your skin can be oily and dehydrated at the same time? Yes, it definitely can. My skin used to be extremely oily, but tight. I would wash, put moisturizer on, not even 10 minutes later, it's feeling tight again, and I need to put on more moisturizer. And I've used so many different brands. Really, the only brand that actually treated my dehydration and got rid of it was basically Theravine. So, and usually when they're dehydrated, the skin will produce more oil to compensate for the lack of water. And then you get like this total imbalance of too oily, blackheads, breakouts, but it's feeling tight, it's feeling uncomfortable. So quite difficult to treat, but I must say with Theravine, we treat it quite well. So ideal water balance in the skin, you need to have 13% water in the stratum corneum and 70% in the dermis. Characteristics of a dehydrated skin. You'll find lines and wrinkles. Not lines and wrinkles, sorry, lines. So that fine lines. It almost, like we used to call it crisscross lines. And sometimes you can see it immediately when you look at the skin. That is usually your deep dehydration. But if it's more superficial, you need to push the skin gently. So by just pushing the skin, that's when you will find those little crisscross lines coming up. And the skin really feels tight, especially after cleansing. It always feels tight. After putting on moisturizer even, midday, this client usually feels tight. And the foundation will literally sit on top of the forehead especially. It almost looks like a cakey, it sits right on top due to the dehydration. Can often feel sensitive or rough to the touch. Obviously, they're holding on to all these dead skin cells, so it definitely feels quite rough. They can easily lose elasticity and irritated, so can feel irritated, especially by temperature changes. Even when they cleanse, the skin might feel quite irritated and almost like it's burning. So causes of dehydration, internal factors, so medication, illness, stress or trauma, and really not drinking enough water. External factors like air conditioning, UV rays, number one, the sun, incorrect skincare or overuse of skincare products like over peeling, over doing the microdermabrasion, or over using very harsh products where every single step is AHAs and your barrier never restores or recovers. So there's a lot of things, and especially with people who's traveling, the aircon, the changes in temperature, even when in colder weather like going skiing, skin getting windburned can also cause dehydration. Then there's a few medical conditions that can also lead to dehydration: hypo or hyperthyroidism, diabetes, kidney disease, cystic fibrosis, urinary tract infections, chronic stress, and pregnancy and breastfeeding. Then lifestyles that can lead to dehydration. So pilots or your air hostesses, obviously due to the change in altitude and the aircon in the aeroplane, and obviously the change, like losing like your jet lag and all of that. Athletes, because they sweat a lot and a lot of times they're outside a lot practicing, then working and exercising outside, air-conditioned offices, sun exposure, smoking, high alcohol intake, extreme heat, pollutions So the environment, from factories and car emissions. A fun fact, each day you lose 500 ml of water through your skin. That's quite a lot. And 400 ml from exhaling, without accounting for extra loss from exercise or abnormal circumstances. Therefore, hydrating isn't something you can do occasionally. So for good hydrated skin, you literally need to drink water throughout the day. So that's quite important. I mean, I know people who don't even drink 1 glass of water a day. So it's really important to educate our clients on drinking more water. So without enough water, your skin will start to show signs of aging, such as fine lines and wrinkles. The collagen will break down, aging, and you will basically age dramatically. So adding water to your diet can make you look younger and your skin will appear firmer. Sun exposure breaks down elastin fibers. The sun also disturbs absorbs your water from your skin. This damage of elastin fibers results in the inability of the skin to snap back into shape, resulting into wrinkles. So if you think of an elastic band, as it stretches, and if that elastic band is really old, it's almost like an elastic band dries out over the years. And if you snap it then, or if you pull it then, it can a lot of times literally snap because it's so dried out. And that's basically what happens to your skin when it is dehydrated. Further water loss in the top layer of your skin is through external aggressors. So that can also lead to wrinkles, the skin wrinkles looking deeper, more pronounced, and the texture not looking plump and hydrated. Let's have a look at sensitive skin. I think this will then be our last one for today. So sensitive skin, like we said earlier, it's mainly people who's born with a sensitive skin. The skin is fair, porcelain-like. It can be your light-haired skin, light skin, like your blonde hair, red hair, very light, very fair skins. The skin is delicate, fine textured, flushes easily, and is prone to allergic reactions. Also, like we said, your clients is usually born with it and it's genetic. A sensitized skin can literally be any skin. So it's a lot of times in a dry skin, but it can also be oily. They're usually prone to flushing and the skin feels warm to the touch. They sunburn and windburn easily. Pollution, stress, hormonal fluctuations, smoking, alcohol, poor diet, medicinal procedures, and skin resurfacing can all lead to a sensitized skin. The skin is usually red and blotchy and can also be caused by incorrect treatment or environmental factors. So it's really just overdoing skincare or over peeling, or there's a lot of things that can cause a sensitized skin. Even when you go to the beach, I found one year we were at the beach and I got home the evening, washed my face, and my cream cleanser actually burned. It felt really like uncomfortable on my skin because of the wind and the sun and the water and everything, that it really sensitized my skin. So I obviously put on all my lotions and potions, and the next morning I cleansed my skin and it felt perfect. It wasn't burning, so the sensitivity, it was sensitized, but it's short term. So sensitized skin is usually very short term. And most clients aren't a true sensitive skin. They're really just sensitized. So if we look at the characteristics, they can be dehydrated, the skin feels tight and can easily be irritated by temperature changes, they're prone to flushing and it can feel quite warm to the touch, red and blotchy, and it's really temporary due to being outside in the sun or skiing, and it can really be any skin type, any skin color, anybody can become sensitized. So we did mention the causes. So your incorrect treatment, pollution, stress, hormonal fluctuations, like your clients going also into menopause can sometimes become sensitized. Smoking, alcohol, poor diet, medicinal procedures, and skin resurfacing. So when we want to treat a sensitized skin, we need to avoid triggers like alcohol, spicy food, because that can actually increase sensitivity in your skin because it's increasing circulation. So it can very easily cause your skin to become more sensitized. And avoid exposure to the elements. So the sun, client has been in the sun the whole day, it really does cause the skin to become sensitized. So we need to enhance the natural protective barrier, lipid barrier, or your acid mantle. So that is the main factor that needs to be treated when we want to improve a sensitized skin, because that barrier is stopped. And a lot of times the barrier is literally non-existent with some clients. So by using like a pinotage oil, we are restoring the barrier. You heal the acid mantle. That is the first thing you need to do when treating a sensitized skin. So we need to soothe the irritation, soothe the inflammation. So you will treat it a lot of times the same as a sensitive skin. Um, but your goal is really just to restore the barrier. And I find with some clients who's been on, these very exfoliating products where the cleanser, the toner, the serum, the moisturizer, every single step in the home care contains AHA. And I found that they will say, oh, my skin feels sore, it feels painful, and it's red, the cheeks is red, the skin is tight. And I would literally put them on Theravine, like the oil and a balm. And within a couple of days, it's amazing how the skin is healed because we heal the barrier. So that is extremely important. Then just some other different types of inflammatory diseases or how we see sensitivity in the skin. So like your rosacea, atopic dermatitis, your eczema, that is basically damage to the skin barrier. The skin is dry, itchy, the skin inflammations. Usually these clients will need to go to a dermatologist to get it treated. A lot of times like your eczema can be stress related or food allergy related. I also know a lot of people who get it when they eat wheat or they eat dairy. Then allergic reactions is basically a response to an invader. So your immune system is then triggered, and that results in an inflammatory response. And this usually occurs 2 to 24 hours after the application. So usually I will tell a client to drink like Allergex or antihistamine. That usually works quite quickly. And it is a rapid or sudden response. We don't know if a client is allergic to a specific ingredient. You only found that out once that basically it's been applied and they had an allergic reaction. But you obviously just make sure you do follow up with the client, you take good care of them, so that they don't just feel neglected with an allergic reaction. I actually had a client contacting me last week with the allergic reaction. It was a friend of a friend who went to a spa for a facial, and she got an allergic reaction. And I said to her, but didn't you go back to the spa to tell them? No, I felt bad. I didn't want them to think that it's their fault. And I said to her, but you have to go back and at least just talk to them so that you can find out exactly what facial they did, exactly what caused the irritation or the allergic reaction. So yeah, some clients or they feel shy when they get an allergic reaction, but it's actually so important that if something like this happens, that we treat them obviously with real good integrity, to also let them trust you again, and obviously not to shame your salon or your products as well, because sometimes it might even not be a product. It might be the detergent they wash the mittens with, or Yeah, maybe something else that they used in the treatment. So important with eczema, rosacea, or psoriasis, you will avoid the area. The client will usually go like onto cortisone medication. That can definitely thins the skin. So just be aware of that when you're doing extractions and things, because it can cause bruising, redness, and sensitivity. But usually if a client has like an eczema breakout, they definitely won't come for facial if it's on the face. Then just some things that can also contribute to sensitized skin. Once again, your premenstrual tension, asthma, it can actually increase sensitivity, and these skins definitely can be, or these clients can be prone to reactions. They might have redness, broken capillaries, yellow appearance, or even dry skin patches. So just something to notice. Alcohol. So excessive alcohol intake can definitely cause broken capillaries or redness due to increased skin sensitivity and increase in blood circulation. So just note those things. And that is where I'm going to stop today. And then with our next session, we are going to continue with premature aging and mature skin types. Thank you for joining. Enjoy the rest of your day until we meet again. Bye.